Hi guys, welcome to my channel or welcome back to my channel. Happy holidays or belated holidays, because by the time I post this, the holidays are probably over. I did just want to come and give a quick update on where I've been and how I ended up having an emergency C-section. Baby is here, obviously, so you may hear them in the background. I'm not gonna go over every detail from the second and the third trimester. At this point, it seems a bit unnecessary. If you have any questions, feel free to leave them in the comment section and I will be more than happy to answer them. And I probably will include some photos or little video clips from the journey. So at 14 weeks, Kayon had still not been able to attend any of the appointments. They weren't letting anyone in yet. So we did schedule a 2D, 3D ultrasound appointment at like a different location, not at a doctor's office.
Oh man.
Let's see if I get back to move. Let's see if I get back to move. Hi.
And that was nice. We knew we weren't gonna find out the sex of the baby. At 15 weeks, we found out that we were having a girl. We were very excited and we started to buy little things for her. So anyone that has watched my first trimester update, then you know I was having a lot of headaches that never ended the whole pregnancy. I had an early glucose test early in my pregnancy to see if that was the problem. It wasn't. I had 2 24-hour urine samples collected to see if I had protein in my urine, to see if I had preeclampsia. That wasn't the problem. I did get set up with a neurologist and had an MRI done, which came back normal. The neurologist discussed that it could be migraines or hormonal. There was nothing that could be done for either of those problems. There's no medication, no migraine medication, say for pregnancy, and of course there was nothing that could be done if it was hormonal. However, at 23 weeks, the neurologist did give me a prescription for a pain medication that was safe for pregnancy. I did take it for maybe 3 or 4 days. It didn't work, nothing happened, so I quit taking it. There was no point in taking it if it wasn't gonna do anything. So I stopped taking it. My doctor did prescribe me a low dose of high blood pressure medication. My blood pressure had been creeping up for several weeks at that point. Every time I would go at the beginning of the appointment, my blood pressure would be a little high. Not high yet, but again, it was creeping up. It was a little higher and higher each appointment. And at the end of the appointment, it would go back down to normal. This had been an issue for me since a couple of pregnancies ago. I just was anxious about my doctor's appointment because she didn't want me in any kind of jeopardy of going into labor early. She did go ahead and prescribe me a low dose of blood pressure medication. At 25 weeks, I was diagnosed with gestational diabetes. I was kind of shocked by that, actually. That was the second glucose test that I was taking now. So this one was at the time that it's normally given. My glucose level was 203. They didn't bother having me test again. So she did just have me start checking my levels at home 4 times a day. And she scheduled me with a nutritionist. During that time of being diagnosed with gestational diabetes and seeing the nutritionist, I was keeping track of my levels every day, and I was also keeping a log of everything I ate and at which time I ate it. I gave that to the nutritionist. She looked over everything, including my numbers, and everything was fine. So she didn't necessarily want me to change anything. She did give me like parameters that she wanted me to stay in, that I was already staying in those just naturally, but you know, she has to give me something. So she just told me how many carbs I should be eating with each meal, and how many not to go over based on what I was eating, just other options of similar meals to that I could add to, and snacks that I could add to what I was already eating. So basically she told me just keep doing what I was doing and keeping a log, but if at any point my numbers were higher than what they wanted them to be, to contact her. That never happened, so they said it was just managed with diet. Nobody wants to have high blood pressure issues or diabetes issues at any point, pregnant or not, but I did, and so I just had to deal with it, and everything was fine. I did still struggle with my blood pressure. The bottom number was never at 89 again, but it was still higher at the beginning of my appointments than it would be at the end of my appointments. I just really struggled to kind of try to stay calm and relax. On the 29th of January, so I was like 32 weeks, just under 32 weeks, I had an appointment with my perinatalogist. I saw them every 2 weeks, and every appointment had been fine in the past. Baby was always measuring small since they first pretty much started measuring her. Still within the range of what is average, just on the smaller side of average. And so they always said that it was fine. So as long as she was like growing steadily, it was fine. And she had been up until this appointment. So that appointment at the end of July, the flow through my placenta had decreased, and baby also had not grown as much as they wanted to see her grow. So she told me she wanted me to go to the hospital. Of course, at this point I was very worked up. She kind of gave me a little rundown of what the possibilities were. So maybe they would want to deliver me right away or deliver her right away. Maybe keep me and try to get me to 34 weeks and then deliver, or monitor me for a few hours and send me home. She said she didn't think that would be the option that ended up happening, but if it did, she wanted to see me in the office every other day. So I went to the hospital. They did admit me. They didn't say how long I would be staying or what exactly the plan was, but they did admit me. And that first night they also gave me, that first night they did give me my first shot of steroids to help get her lungs developed in case she came early. First shot was fine. It wasn't bad at all. I got the second shot 24 hours later. That one hurt a lot. So my second day in the hospital, my doctor, I have been asking all of the nurses like if I was gonna go home, when I was gonna go home, and no one had an answer for me. They were also monitoring baby. Like I had the little monitors attached to my stomach the whole time I was there. I really wanted to go home. I hadn't finished everything that I wanted to get finished for her. We'd put together all of her stuff. The crib was put together, and the stroller, and her bassinet, and everything was put together, but there were just certain little things around the house that I hadn't gotten finished yet. All of her clothes hadn't been washed. Most of them had, but all of them hadn't, and I just didn't feel totally prepared for her. By the second day, my doctor came to talk to me that first thing that morning, and I of course was asking her like, when am I going home? Am I going home? What's gonna happen? She first wanted me to see neonatologist at this hospital because this was a different hospital than my neonatologist, and she said they would make a decision then. And she basically told me the same things that my neonatologist had told me. A few hours later, the neonatologist did come in, and he told me, of course I asked him when I was going home, he told me what the concerns were, and he told me some of the possibilities. So what he was most concerned about was that I had something called superimposed high blood pressure, I'm pretty sure, and that could just give a lot of issues for you and for baby. That was his main concern. He said he didn't think that was what I had based on the lab work that had already come back, but he just wanted to run a few more tests and look things over, and then they would make a decision. Him and my doctor would make a decision on what they thought was the best route to take. He also gave me, some of the possibilities of things that could happen. Maybe I would be sent home. Maybe based on the lab work, he would want to deliver her right away. So he said if that happened, it would be the first thing the next day. So first thing on the 31st. Or they might want to keep me until 34 weeks and then deliver her. Or if nothing was wrong and she was perfectly fine in there, maybe they would want to just get me full term, keep me in the hospital during that time, and then deliver her. So at that point, I just stopped asking about going home. It seemed like it was just safer for me to stay in the hospital. So I just hoped that they would be able to get me to 34 weeks before she came, and that she wouldn't come too early. For several weeks, I had been each milestone, each week I was looking up, okay, well, what are her chances of survival if she came now? I don't recommend that necessarily to anyone. So I knew that at 32 weeks, her chances of survival were really good, almost as good as full term. And that she just may have to stay in the NICU. Although, all of the nurses that came in and things, they had, and my doctor, they had been probably trying to prepare me for her going to the NICU, but unlike me at all, I was really letting it go in one ear and out the other. I just couldn't even fathom that she would go to the NICU. So I stopped talking about going home. I just was trying to relax, trying to stay calm. I would prefer to just stay in the hospital. If anything happened, she was being monitored and they would know right away. So that's what I did. The times of this may be a little off because I didn't really have a great sense of time for several hours. At some point, first thing after, midnight, maybe in the 1 or 2 o'clock hour a.m., the nurse came in and said that baby's heart rate was dropping, and the doctor wanted her to give me some IV fluids to see if that kind of perked her back up. So she did. And a little while later, she came back in with the doctor. I don't even know if I had finished the IV fluids or not. I don't remember it feeling like it had been very long, but maybe it had. Either way, I'm guessing based on the time they delivered her that it was somewhere in the early to mid 3 o'clock hour. I'm assuming maybe even late 3 o'clock hour. So maybe I had finished the IV fluids. So the nurse and the doctor came back in. They told me that her heart rate was still dropping, and so they were going to need to go ahead and deliver her. So they told Kayon to, do whatever he needed to do, call who he needed to call, get our things together. They would be back to get him and to put on some scrubs that they had given him. So we went over to the operating room. I kept asking about Kayon being brought in, and again, I had no sense of time. I don't know how long these things were taking, but they kept saying like, oh, we're not gonna forget him, we're not gonna forget him. They numbed me up. I don't know if it was an epidural or something else in my spinal area, but I was numb. They brought Kayon in. My doctor came in. She said hi to me, and the other doctor was with her as well. They checked to see if I was numb, and I was, and they got started. It seemed really quick, a matter of several seconds, maybe a minute. It wasn't very long. At 4:55 a.m., baby girl was born. I heard they told Kayon that to look over the curtain. He did, and he took a quick picture. I heard a faint noise, and I asked if that was her, and it was. They brought her over for just, very quickly while they were headed to the NICU. They let me see her, and she was gone. I didn't know anything at that point. I didn't know how big she was, or I didn't know anything. We went to the little area where they, monitor you, and we were there for not long, guys. And then we went to the room where we were gonna be staying in. When we got there, I was able to speak to, Kayon called the NICU for me, and I was able to talk to the nurses about her and find out, how she was doing. She was 3 pounds and 6.7 ounces. She was 15 inches long, and she was doing pretty well. Kayon was able to go ahead and go see her at that point. I was not yet. So he did. He took some pictures and things. At around 4:20, 4:30, I was able to go see her. Kayon wheeled me over. It was the best, but it was also scary. She was pretty small. She was on oxygen. She had an IV and a feeding tube. I met the nurses and the doctors, and I stayed there for a few hours, and then I went back to my room. By that evening, I was walking to the NICU. That was the first time. I walked over with Kayon, just holding on to the wheelchair. I didn't want to be stuck waiting on people to take me to the NICU. So it was important to me that I start walking there right away. I met the night nurses. That was fine. They, at that point, that evening, so my second visit with her, I did have to kind of decide that I was not going to ask about when she would be able to go home. I did talk to them about all of the milestones that she would need to meet in order to go home, but not like, oh, is she gonna go home at 36 weeks or, whatever. I didn't ask those questions. I wanted her to go home when she was ready to go home, when she had done everything that needed to be done and was able to do all the things she needed to be able to do to be safely at home. So that night I discussed with the nurses and the doctor what milestones she had to meet in order to come home. She had to weigh at least 4 pounds, 2 ounces. They wanted her to be 35 weeks. She had to not be having any kind of DSAT or so no breathing or heart problems. She had to be taking her full bottle and finishing it within 20 minutes. She had to pass a car seat test, which was 90 minutes sitting in a car seat without having any breathing or heart problems. She had to be off of everything. So off of the oxygen, off of the feeding tube, off of the IV. And those were all of the milestones. And I believe those are the basic milestones. So when we went back to our room that night, we did say okay, by the next evening, she has to have a name. We had to pick a name for her. And we did. So day number 2 in the NICU, she was jaundiced, so she went under the lights. Day number 3, she went off of the oxygen and she had her name. We went with Paisley. On the 4th, she was taken from under the lights. The jaundice was mostly gone, and they thought that she would finish kind of clearing it up on her own, and she did. On the 6th, they removed her IV. I was very happy when they removed her IV because it just looked so uncomfortable. and it was just one less thing that to annoy her. So I was really happy when they took the IV out. They were also, from about the second day, were steadily increasing her food, the amount of her food. And she was steadily losing weight. And I know babies lose weight when they're first born, when they go home. She continued to lose weight, and it did become pretty stressful for me because I didn't realize that it could go on for so long. It was about 2.5 weeks of her losing weight, or maybe gaining a little bit of weight and then losing it. She got down to 2 pounds 9 ounces, and yeah, that was pretty difficult. On the 8th, initially she was in the back of the NICU, and most of the babies were back there. There were a couple in the front that didn't really need much assistance, and as the babies needed less assistance or were closer to going home, they would move them closer to the door. So on the 8th, they moved her closer to the door, so they moved her to intermediate, and we were, of course, very happy about that. They also turned off the heaters on her bed, and she was able to regulate her own temperature. So that was nice. She was just knocking off all of these things that she needed to knock off in order to be able to go home. On the 15th, we tried to bottle feed and tried to get her to latch. Now, I had been pumping since day one. Ideally, I wanted to be able to give her exclusive breast milk. That didn't happen because I just never produced enough. We pumped and breastfed for about 3.5 months, and I just never produced enough for her, so she was always taking formula as well. So on the 15th, we started with the bottle and tried to get her to latch. She took a big gulp of the bottle and choked, and then we were done with the bottle for that day, and they finished her feeding with her feeding tube. They did tell me that that is a hard motion for preemies to learn. So the sucking the bottle, swallowing, breathing motion, so that order, and then, repeating, that it can be difficult for them to learn that. It was just on her time. So they were trying the bottle 1 time a shift at that point. They were trying the bottle 1 time a day. 1 time a day they would try the bottle. She was also able to put on her first little outfit. She was so cute. I ordered a couple little things, little preemie onesies from Amazon. Even those, once she was able to put them on, were still pretty big on her. On about the 16th, in that area, I was told that she tested positive for SCID. It's SCID. It's a autoimmune disease. When he told me, and he was sitting there and he was telling Can and I what it was, and I started Googling it. He told me not to Google it. Of course, I didn't listen. I was Googling it. It was terrifying. The life expectancy was pretty short. They would just always be sick. And it was scary. It was scary to think that that could be her life. They tried to reassure me that she didn't have this. The doctors and the nurse, they were just so confident that she didn't have this. They said that several of the preemies that had their test done had come back positive for this, and they just retested. There is an increased risk of false positives in preemies. Apparently, I didn't know that at the time, but it was scary. So they tested her again, and I stopped Googling things because I had terrified myself, and I didn't want to go to the hospital and have that negative energy, and I just wanted to be able to be present and in a good mood and not worried and tied down. I just wanted to be able to give her the attention that she deserved and not be focused on something else, something very negative. So I didn't ask, I asked my questions, but then I didn't keep focusing on it. I didn't keep Googling things about it. I just waited for the second test results to come. And on this day, when I got this news, she also had gotten back up to her birth weight. So I was happy about that. On the 23rd, she took her full bottle, but she was also, so from the first time that she took her bottle, they moved from 1 time a day to 1 time a shift. At this time, she took her full bottle. She also was having a lot of DSATs. Her breathing would get really shallow. And it would happen throughout the day, but it would happen a lot after her feedings. So they were concerned that maybe she might have an infection or pneumonia. So they did some blood work and she didn't have any kinds of infections, and they did an x-ray. The x-ray did show a small streak in her lung. They went back to exclusively feeding through her tube and gave it a few days. They said it didn't look like pneumonia and they thought that it was probably some formula. They gave her a few days. She went back on oxygen just a little bit. They gave her the IV again. That was difficult just because it felt like it was a step backwards, but that's what she needed, so that's what we did. By the next day, they were already weaning her off of the oxygen because it wasn't a lot that she was getting, and by the following morning, the oxygen was gone and the IV was also gone. Once her blood work came back that she didn't have any infections, they took the IV away since they weren't going to have to give her any fluids. At that point now, the IV is gone again and the oxygen is gone again. They did another x-ray and the streak was gone and everything looked good. So they started the bottle feedings again. And this time she did much better. There was no choking or anything. She was good.
Hello, precious. We are here with baby Paisley.
So
she is getting her eat on. And she is doing quite well. She looks like she is back on track to do her thing with this bottle, and we are grateful for it.
So that was on the 25th that she started the bottle feedings again. On the 28th, we got her genetic test back and it was negative this time. So of course we were very excited about that. On the 31st, they totally removed her feeding tube and she was also latching. So now she had nothing. She didn't have any oxygen. She didn't have the IV or the feeding tube. On the 1st, she did her car seat test. So the 90 minutes in the car seat without having any kind of heart or breathing issues, she passed that. And on the 2nd, there was a lot of there had been since about the 1st, maybe since the 31st, a lot of chatter. I had gotten very close with the nurses because I was always there. And so there was a lot of looks like Paisley's gonna be going home soon, but there was never any Paisley's going home on this day, and I never asked. So on the 1st, she passed her car seat test. When I was coming for my 2nd visit and the day shift was leaving, I saw her nurse, and she told me before I even got up to the NICU that Paisley had passed her car seat test. So I was really happy about that. So we still hadn't asked like, oh, is she going home? And no one still had said she is going home. So as far as I was concerned, I knew nothing about her going home. On the 2nd, when I went to visit her in the morning, so again, I was going 2 times a day. I was going in the morning for about 3 to 4 hours, and I was going in the evening for about 3 to 4 hours. And in the evening, Kayan would go with me once he got home from work. So on the 2nd, when I went in the morning to visit with her, she was doing great, and she just looked so good. And there was a lot of chatter about Paisley going home and like giving me paperwork and things and getting certain appointments set up. And they told me then that Paisley was going home that day. And they were just waiting for the doctor to come, give her one more look over, and discharge her. On the 2nd of September, Paisley got to come home. Since then, everything has been good. She's gained weight steadily. When she left the hospital, she was not even 5 pounds. She was almost 5 pounds. I will include also some of these, like every day at the hospital, they would give like a little progress report just to kind of tell like how things went at the last shift or like the last 24 hours. So that is how Paisley ended up coming early and how she's been doing. She's asleep right now, so when she wakes up, I will come back and let you all meet her. Hi guys, we're back. So Miss Paisley is awake now. Say hi, Boop. No, you don't want to. Much bigger and more active than when she first came home. Thank God. She is doing very well. She's almost 5 months. She is starting to teeth, but she prefers her fingers and my fingers and anyone's fingers over her teething rings. So she's distracted right now because she's looking at Milo. Overall, everything was as good as could be expected, I suppose, having, you know, with your child coming early. She didn't have any serious health conditions. She didn't have to stay in the NICU for a long time. I mean, yes, 31 days. I mean, it's a long time, but there were babies in there that were much smaller than her, that were there before her, and that were still there when she left. So, I mean, overall, I think I'm grateful for how things went, because they could have gone a lot differently. So I don't have any complaints. I don't actually talk about my C-section for some reason. It feels very traumatic to me, but nothing went wrong with it. Everything seemed to go perfectly fine. But I'm just so thrilled that she's here. She's the best little gift ever. So thank you all for watching, and we will see you in the next one. Bye guys.